This video is brought to you by Surfshark VPN. What's up, guys? Michael and his exceedingly fancy library here. Regardless of how you've been feeling about the state of life under quarantine or semi-quarantine, chances are we've all had one shared experience: confusion. But among that confusion, there is one consistent refrain: we just gotta figure something out until there's a vaccine. Once we get that sweet, attenuated, inactivated, or modified virus in our bodies, nothing will stop me from dining in at the Olive Garden. But as much as I can't wait to carbo-load unlimited lukewarm breadsticks with my fellow Pasta Pass family, there is one thing this whole COVID crisis has revealed about how we think about health. We as a society love to worship medicine. And don't worry, I'm not here to hate on all the medical advancements that save millions of lives. But there is one thing that gets lost in the mix: public health. And while this term has become a cool new thing everyone gets to learn about during our plague-ridden apocalypse, I think there's a general sentiment that it's just the thing you do until medicine catches up. And to figure out why, in general, that's an awful perspective, I want to talk about one of humanity's most lethal diseases: tuberculosis. Welcome to this Wisecrack Edition on how to stop a plague. But before we get into it, I want to give a shout out to this week's sponsor, Surfshark VPN. If you're anything like me, you online shop more often than you go to a store. I mean, I can't remember the last time I went to a mall. That means I usually am using my bank info on various sites. It's just one reason why I find a VPN to be invaluable. A VPN is a virtual private network, which means that once it's turned on, it sends your data through an encrypted tunnel which protects you against malicious cyber attacks by shielding your information. With Surfshark VPN, you can feel safe using your computer, phone, game console, or any other device to make a purchase. Surfshark goes above and beyond with their additional features like Clean Web, which blocks ads and malware that may pop up while browsing, and Blind Search, which protects your browser from serving you targeted ads or sponsored sites. The best part is that if you use the link in the description right now, you can get Surfshark VPN for 85% off its normal price, plus 3 extra months for free. Go to surfshark.deal/wisecrack or hit the link in the description. Protect yourself online and download Surfshark VPN today. Now, for context, tuberculosis is one nasty ass disease. Fettuccine Alfredo left out in the sun for 48 hours nasty. It is thought to have leapt from bovids, i.e. cattle or bison, approximately 17,000 years ago. In its time, TB has killed as many as 2 billion people throughout history, making it as evil as like 2.2 million Jonestowns. It's airborne and can cause symptoms in its host anywhere from weeks to decades after exposure. That's right, this disease can hide in your body longer than The Simpsons has been on TV, which is to say, way too long. Like COVID-19, symptoms range from asymptomatic to holy I'm dead. In serious cases, the TB bacteria replicates within the lungs, causing pneumonia, coughs, night sweats, chest pain, and exhaustion. It can also catalyze such a drastic loss of weight and strength that it appears to consume the afflicted patient, which is why it was eventually dubbed consumption after striking the world with renewed fervor in the 18th century. TB surged in Europe and America at the onset of the Industrial Revolution, as historian Frank Snowden explains in his book Epidemics in Society. At the time, it was known as the White Plague because of the way it drained all the human colors from your face. The medical establishment understood basically nothing about the disease, presuming it to be hereditary. And because many famous artists contracted the disease, often writing or painting or composing great works while seriously ill, TB became, and I'm not joking, kinda cool. The disease itself was said to generate intoxicating effects and drove creativity, although as scholar Matthew Gandy notes, widespread opiate addiction probably better explains this mental effervescence. For women, the disease became associated with physical beauty, and the emaciated body, pale face, flushed-cheeked look caused by TB became the height of fashion in some places. Women would basically stop eating or exercising and wear white face powder and blush to cosplay as consumptives. That said, most victims of tuberculosis weren't wealthy poets. They were members of the urban poor, but we'll get to that. But as germ theory spread throughout the scientific community in the late 1800s, tuberculosis stopped being a cool rich person disease and started being something society wanted to declare war on. It became viewed as a disease that punished the poor for their wretchedness. Not only were people in overcrowded slums, tenements, prisons, and almshouses more likely to become infected, malnourishment and pre-existing diseases put them at a much higher risk for developing the life-threatening variety of TB. In some countries, a concurrent imperialistic urge to maintain a strong military made tuberculosis, especially in crowded barracks and on the front lines, a real existential danger. This changed mindset helped give rise to what Snowden calls the war on tuberculosis. From approximately 1880 to 1940, which relied primarily on various public health interventions to prevent the further spread of the disease. Here's where it's helpful for us to quickly distinguish between medical intervention and public health. A medical intervention is basically everything you associate with going to the doctor, getting a procedure done, being prescribed a medication, etc. Public health is everything outside of that interaction. If getting a vaccine is a medical intervention, public health is determining what vaccines people need, who to distribute them to, what new vaccines to research, and educating people on the benefits of immunization. And interestingly enough, long before TB treatment actually worked, TB rates plummeted, starting in the mid-19th century in Europe and America because of a combination of intentional and accidental public health measures. One such strategy was the rise of the international sanatorium movement, which advocated for isolating tuberculosis patients at what were essentially fascist Club Meds. They were first conceived of by a German physician, Hermann Bremer, who experienced tuberculosis and healed in the Himalayas. He credited his recovery to fresh air, climate, and rest, and so started a sanatorium to standardize such treatment. But the trend didn't really catch on until the 1880s, with the establishment of the first American sanatorium, Little Red, near Saranac Lake in upstate New York, where patients were required to spend 8 to 10 hours a day outside soaking up the fresh air. They also had to abstain almost entirely from exercise and eat a target of 4,000 calories a day to combat the consumptive effects of the disease. Believing that negative emotions like shock or anguish stoked the illness, nurses censored patients' mail to protect them from bad news. These sorts of rules varied from institution to institution, but across the board they made for a highly restricted life. At the same time, it also effectively quarantined those who were contagious, which helped make a dent in the spread of the disease. Getting into Little Red was a highly competitive process, and many folks who were rejected moved to Lake Saranac anyway. So the town became a sort of epicenter for TB treatment, like a Disney World for the very ill. While the medical intervention here is questionable, the strategy had the inadvertent public health benefit of slowing further spread of TB. Typically, after spending time healing at the sanatorium, patients would then return to their urban homes. From there, they would rely on dispensaries or medical centers that provided both medical care and public health strategies, like offering monetary loans or helping patients find work. Importantly, these dispensaries, along with a slew of NGOs, also offered community hygiene education, warning against the dangers of sneezing without covering your nose, and obsessing a little bit over the comparatively less risky act of spitting. Concurrently, starting around 1840, and admittedly a little ethically questionable, was the segregation of the poor suffering from TB into workhouses. And it's widespread movements like this that really helped contain the disease from further spread. As scholar Matthew Gandy notes, before the infectivity of the disease was understood, British workhouses admitted ever greater numbers of consumptive patients. Continuing, the issue then is not the effectiveness of treatment, but the impact of containment on rates of infection. Another social campaign about the spread of cow TB led to the screening of herds for the disease and the now ubiquitous practice of pasteurizing milk. At the same time, these public health efforts intensified. Improvements in nutrition, urban housing, and the proliferation of more hospitals were concurrently fighting TB. While public health was kicking TB's ass, what new treatments were doctors concocting? Just a little thing called artificial pneumothorax, which basically collapsed and paralyzed the patient's lungs, which they thought would allow them to heal like a broken bone in a cast. Needless to say, this did not work. A vaccine was debuted in 1921, but it was mired in controversy because it A, was not totally effective, and B, doesn't protect against all forms of TB. By the time antibiotics for TB came around, reported cases of TB had already plummeted across Europe. Of course, even on the public health front, there's a debate about what stopped TB. According to some, including historian Thomas McCowan, TB was stamped out by a cocktail of social and economic interventions. He points especially to improvements in nutrition, which strengthened people's immune systems, thus making them less susceptible to its ravages. Other scholars pushed back on this interpretation, leading to a battle between nutritionists, or those who credit the decline of TB to better human resistance against the disease via improved nutrition, water, and overall standard of living, and contagionists, or those who stress the reduced sources of infection due to a variety of public health interventions. Contagionists believe that the decline in TB was due to successfully identifying and quarantining afflicted patients vis-a-vis sanatoriums as well as broader public health campaigns with dispensaries and NGOs. Regardless of what you believe, it's super important to note that it was some form of public health efforts and not medical intervention that effectively combated this disease for decades, affecting change in everything from workplace safety regulations to improved sanitation. Sometimes the public health part isn't even intentional. Robert Koch suggested that even housing design could influence how infectious the disease could be. You might be asking, so what? We've got drugs now, housing design be damned. And I'm only a few clinical trials away from getting my breadstick on. After the antibiotic revolution began in the 1940s, doctors believed the war on infectious disease to be won. It was declared a dying field and med students were discouraged from studying it. But it's precisely because we declared victory so confidently that we're all f***ed. Let's start with something you might have heard of: antibiotic resistance. In 1943, Selman Waksman developed streptomycin, an antibiotic that when tested on a TB patient led to full recovery. According to Snowden, this monotherapy or treatment via one rock-solid drug really seemed like a miracle cure. However, doctors soon realized that the TB bacteria was becoming resistant to the meds, so folks who underwent treatment were becoming sick again. And what's more, were now immune to the only real treatment. So doctors developed two new medications, isoniazid in 1952 and rifampicin in 1963 to supplement it, and began treating patients with all three. Thanks in large part to these discoveries, TB declined for decades, up until the mid-1980s, and everyone expected that the disease would be eradicated by 2010. So we're in the clear, right? Not so fast, you rascally optimist. TB eventually became resistant to all three medications. And that's when the was about to really hit the proverbial fan. Nowadays, the research laboratory is the focus of public health rather than social or economic efforts. As an article in the American Medical Journal notes, departments of public health shed sanitation, housing reform, and even hospital care. And now tuberculosis is back. In 1985, TB cases stopped declining. Over the next 2 years, rates started rising in the US and blossomed into a full-on pandemic in Eastern Europe, Southeast Asia, and Sub-Saharan Africa. By 1993, the WHO declared tuberculosis a global emergency. So much for eradication. Remember how people living in poverty were particularly at risk for TB? Within the US, those most likely to be afflicted were traditionally marginalized and impoverished folks, such as those who are homeless or in prison. What's more, the emergence of HIV created a brand new class of people who were more susceptible to the bacteria. One really illustrative example can be seen in New York City, which served as an epicenter of an outbreak in the 80s. The city had experienced a fiscal crisis in 1975 that led to severe budget cuts, which caused the dismantling of health, public safety, and social service infrastructures, and the deterioration of living conditions for vulnerable populations. Most ruinously, the Department of Health slashed budgets, shuttering district health centers, chest clinics, and the city's TB hospital. As a result, when the crisis re-emerged, existing hospitals were overwhelmed, had fewer staff, and fewer resources to track the treatment of those who were sick. Here we see why a medical intervention, antibiotics, is not sufficient in and of itself in stemming a disease. You also need proper public health infrastructure to administer the treatment, track the patient's recovery, and prevent further spread. On a more global scale, Snowden also credits the disease reemergence to the massive displacement caused by refugees fleeing war, economic catastrophe, or environmental disasters, citing refugee camps as a perfect incubator for spreading the illness or just reactivating dormant cases. In Sub-Saharan Africa, the devastating proliferation of HIV made a huge population vulnerable, while in Eastern Europe, the fall of communism dismantled the medical infrastructure, making it harder to seek treatment for TB. To this day, doctors and scientists face an often drug-resistant disease that, in the absence of adequate public health infrastructure, appears to show no intention of letting up. In 2017, the World Health Organization estimated that there were over 500,000 cases of multi-drug-resistant TB. So, as you can see, the battle against tuberculosis has neither been simple nor entirely successful. In 2018, 10 million folks fell ill from TB and 1.5 million died. And importantly, the history of tuberculosis shows to some extent why waiting for medical treatments is a gamble. Don't get me wrong, there's plenty of examples where a baseline public health measure like mass vaccination can make us all chill out and not worry about getting polio. But the reason TB is so interesting to us is that, one, we see a disease being greatly reduced at first without any substantial medical intervention, and two, we see the disease resurging long after we discovered an effective medical treatment. What this shows is how critical public health efforts, absent of medical intervention, really are to stop the spread of a disease. And as we face down COVID-19, collectively holding our breaths that a vaccine will manifest before the next football season, we might get a little too used to relying on medical advancement instead of good public health infrastructure. And I'm not just talking about stay the home or the importance of looking like a bank robber. I mean disease trackers who can stop a pandemic before it starts, research into diseases emerging in livestock and bats, affordable distribution of vaccines and treatments, and so on. Because if experts are warning us of anything, it's that we can expect more novel diseases infecting humans from our animal friends. And these might be way different or worse than COVID-19. A big thanks to our amazing patrons for supporting the channel and our podcast. Hit that subscribe button, and as always, thanks for watching. Later, guys.